Hi everyone, my name is Bayle Conrad and I'm a program coordinator at Harborview Medical Center. This is a series of presentations on how to apply for SSI for newly arrived refugees. This presentation will cover post-SSI interview tips for follow-up. This presentation is going to cover a few tips for what to do once your client has completed their SSI interview. Some of this information was presented in earlier presentations, but this will provide a good summary to make sure that you're on top of the claim and you've completed all necessary items after the SSI interview has been done. As I mentioned in a previous presentation, one tip is to submit a packet of all the documents Social Security might request. This includes the I-94 or immigration document for your client, a copy of their ID, if they're receiving DSHS benefits, a copy of the award letter and their lease agreement, as well as signed paperwork like the 827 medical authorization form and the 1696 authorized representative form. At this point, your client should be receiving paperwork in the mail that confirms they completed their SSI interview. And this should happen pretty quickly after that interview. I would say within a month, they should have received this paperwork. In the paperwork, if there is other information or documents that Social Security needs, they will request them from your client. So this is a really important document to make sure that your client receives and to follow up on if there is outstanding information that's needed. And you can submit all of this paperwork together with a cover sheet that explains what's included, that your client is a refugee, and that you are their authorized representative. Another tip that I've spoken about throughout these presentations is becoming an authorized representative. Like I've mentioned, this allows you to closely follow your client's claim. And one of the reasons I really encourage this is because if your client is approved for SSI benefits, they will get back pay starting from the month that they first applied. This can add up to thousands of dollars that's owed to your client. And given the complexity of SSI claims, the fact that SSA really communicates mostly by mailing letters that are not translated into other languages, and just the fact that there's really quick turnaround times if SSA is asking for additional information, it can be really easy for a claim to be closed or denied if it's not being really closely followed by someone who knows the process. So that is one really good way to make sure that your client has the biggest opportunity to be approved for these benefits. Another tip I learned by following several clients at a time that have SSI claims is to really help organize myself to make sure I'm following up with their claims. And so, that might be creating a spreadsheet and ticking off every step in the process. It might be adding a calendar reminder to call Social Security every 4 to 6 weeks for a status update. When you're calling, you can say something like, I'm an authorized representative calling on behalf of a claimant to get an update on their SSI claim. You will then be asked the verification questions that were described in the presentation on becoming an authorized representative. And that's really a point in time where you can talk with someone from Social Security and really get an update at where the claim is. Oftentimes, the representative might tell you, oh, the claims at Disability Determination Services, we're waiting for a determination. And then you can ask, like, when should I be expecting that determination? And they might tell you 3 months. In that case, you obviously don't need to call every month for an update, but just trying to track the claim as closely as possible and communicating with Social Security to get that information and to figure out, is there anything that's, not submitted that is needed at this point, can be really helpful. The other way to really closely follow a claim, and this can be time consuming, but this might be where you have a casework assistant or an intern or someone else who's working with you call Social Security, but making sure that they've received the documents you've sent in. This will save you time and heartache so that the claim isn't denied and you're not aware of it, so you don't have to start all over on a claim. Like I said, I know this takes extra time, but if it's at all possible to coordinate these calls, maybe you call about more than one client at a time, just double checking to make sure, especially that your authorized representation form has been submitted and received by Social Security, can be really helpful to save you time in the long run. You really don't want to be in a position where you are unable to talk to Social Security because they're claiming they haven't received that document. So really following up and keeping yourself organized in order to make sure you know what the next step is for each of your clients, I found to be very beneficial when working on these claims. Another tip is to contact medical providers. Really depending on your relationship with the medical systems and the providers that serve your clients, they can provide additional support for your client's Social Security application in a few ways. So one of the dilemmas that you might face working with newly arrived refugees and other similar immigrant status clients is that they might not have a lengthy medical history in the United States, and they might not have a full diagnosis. This can be difficult because you might be concerned about applying too early for SSI without as much medical evidence, but you also might want to apply as soon as possible so that the client gets the benefits that they're due and potentially gets back pay for waiting until their case is approved. And this can be a little bit of a delicate dance to figure out the best time to apply. So one of the ways that you might gather some additional useful information if you're facing this dilemma is to contact the medical provider, particularly the primary care provider, or if there is a specialist provider who's doing much of the appointments for your clients, that might also be a useful connection. In order to do this, you might need to have your client sign a release of information or give permission for you to speak directly with that provider. But there's a couple of ways in which medical providers can provide you with additional useful information around both making the decision about when to apply for SSI and also providing additional support for the claim. So in very simple terms, the medical provider might have a general idea of whether your client can work after seeing them and clinically evaluating their symptoms and their diagnoses. This doesn't mean that they will be approved for SSI, but this can just be an additional source of information that you can use to determine whether your client might qualify for SSI benefits. Even if the provider doesn't really understand SSI benefits or doesn't know the process, just simply trying to get a sense of what they have found to be the client's limitations could help you know if there's gonna be enough evidence to get the claim approved. Another thing that providers can do is they can often give you a sense of the specialist referrals your client might receive and the timeline for receiving those referrals. So if you're not sure exactly what your client's diagnoses are, or you're not clinically trained, so you might not understand the medical records, talking to the provider, the primary care provider in this case, can really help you understand if the specialist referrals are going to provide additional evidence to support their diagnoses or to support, some of the symptoms that they're facing. And it might help you understand a little bit better the timing of when to apply. For example, if an important specialist referral has been put in and your client's been scheduled for that appointment within the next few weeks, that might indicate that it's fine to apply because Social Security will get those records pretty quickly to help provide evidence for the medical case that you're making. If the appointment is really far out, there's a couple of things you can do. You can work with the primary care provider to see if there's a way that maybe there's a different referral that can be made for that specialist to get your client seen earlier. The provider can also, again, tell you how important that specialist care clinic will be in terms of the person's care. And if it's an appointment that is really far out, the provider can sometimes put in a more urgent referral or work with the specialty clinic to see if they can get your client in sooner. The final thing that a provider can potentially do, and this really depends on your relationship with the provider and might require a little bit of work on your end, is they can potentially write a letter supporting the case. So again, just like the first point above around giving you a sense of whether your client can work, having a doctor write a letter supporting an SSI case does not mean the case will be approved. It just is an additional source of evidence that SSI will use when evaluating the case and whether the case qualifies for SSI benefits. The work on your end might be creating some sort of template to provide a doctor in order to help them kind of provide the information you're looking for. But in general, a letter that includes sort of the background and history of that patient, their medical history, and specifically information about maybe things that they were diagnosed with overseas, and whether they are able to re-diagnose that condition here, any labs or other tests that have been done to kind of validate that diagnosis, things like that. And then additional information about kind of the client's functional abilities as they relate to work. So if the client, for example, clearly has some neurological limitations, but it's not clear yet what they are because their neurology appointment is 6 months from now, this is where a primary care doctor could write a letter and just simply list out or write out the limitations that they've noticed when seeing that client in clinic. Like maybe they are not aware of where they are, or they don't know what year it is, or they have a really difficult time remembering things. All of that information written in a letter and signed by a doctor can be really beneficial for an SSI claim, especially if you're in a situation where it's clear that your client likely has a qualifying disability, but they just don't have enough information or evidence in the United States to make as strong of an argument as you'd like. In terms of getting a letter, if you do get a letter from a doctor, you're able to have a doctor write and sign one. You can submit this at any point in the case by fax or mail, and as soon as possible after the interview can be really helpful to have that as part of that client's packet of evidence that SSI will then look at. Another tip is to involve your client in the SSI process if possible. So the process for applying for benefits through Social Security is complicated and time-consuming, and you might feel overwhelmed by that as a caseworker. If you're working with a client who has the skill set and availability to do some of the follow-up pieces on their own, this is a good opportunity to teach or train that client for how to either call or go to the Social Security office and try to move the claim forward. One example of a way you can do this is to write a letter for your client to take to the Social Security office stating what they need from the representative that they meet with. This could be something like if you're having difficulty even getting the SSI interview appointment scheduled, You could write a letter stating that your client needs to schedule their interview, and that way they can provide that to the representative they speak with when they go to the office in person. If you need more of a status update or you're trying to figure out where they are in the process, you could also write a similar letter and have your client bring that to the office themselves. In this case, I would make sure your client knows that it might take several hours of waiting and explaining the process of how waiting works within that office. For example, I know some Social Security offices have a number system where you need to pull a number when you arrive. And so maybe, spending some time to explain how that works so your client understands what they need to do when they arrive. This can really help build trust in terms of your relationship with your client, but also it can help build confidence in interacting directly with the Social Security Administration. And since eventually your client will likely have to interact directly with Social Security, if it's possible and if it's a client that you believe would have the skill set and ability to do some of these follow-up items, providing a little bit of training about how to call Social Security or how to go in person can potentially save you some time in following up with these claims. As a final tip, knowing the application process for SSI and sort of the timing in which you should expect to receive certain documents or the types of documents that might be asked for can be really helpful in making sure that you are following up with the claim and that all of the information that's asked for is completed and sent in. Things can get lost in the mail. Your client might receive paperwork that they don't realize is important. And so just sort of knowing the general way that these claims process can be really helpful. If you're new to applying for SSI for a client, I know this can be really daunting. It seems very complicated and complex, and you might feel like you're really unsure of what to expect next. So at the very minimum, unless your client is denied quickly, which usually only happens if they're over the income maximum, and there will be another presentation going over that process, you should expect to receive 2 letters at minimum in the weeks and months following the SSI interview. The first letter is one I've mentioned previously. It's basically a letter that states the application was completed, the interview was completed. It will list out all of the questions asked with your client's answers, and it will also include a request for any documentation that's still needed. Like I mentioned, that letter comes pretty quickly after the interview. If you haven't received it or if your client hasn't received it within a month or so, I would contact Social Security. You should also be receiving a copy of all the letters sent to your client, but the timing of that really depends on when you send in that authorized representative form and when that's processed by Social Security. So it's possible that you might not get this letter and it would only be sent to your client. The other document that your client will be sent for sure is called an adult function report. And this is a report that is filled out once the claim goes to Disability Determination Services. If you're unsure what that means, there's also another presentation on this topic. But for now, just knowing that at minimum, your client should receive those 2 forms or those 2 documents. They might receive other ones if there's additional information that's needed by Social Security, but keeping track of whether those have been received is a really good place to start if you're new to these claims, and then reaching out to Social Security if they haven't been received. Usually the adult function report is sent out within 6 weeks to 8 weeks time, making sure you're kind of keeping track of that and you contact Social Security if they're not received is one way you can be a really good advocate for your client with these claims.